Today we're going to talk about painful sex. So if you're having pain on intercourse and you don't know why or you don't know what to do about it, stay tuned. Today I'm going to talk about some of the common reasons why you might be experiencing painful sex, also how to differentiate and understand your pain so that you can get to the bottom of it, and then I'm going to go through some treatment options and what exactly you can do about it and how you can resolve it. Now, I'm not going to talk about libido because that's a whole other topic. There's going to be another video on sex drive, so check that out. But right now we're going to talk about specifically the pain. So assuming that you want to and are ready to have sex, but there is pain associated with it. Now, I wanted to get into this topic because in my clinical practice, I see so many women talk about women's health, but it's like in hushed tones and sort of, quietly talking about it as if there's something to be ashamed of. But I find that women's pleasure in particular, we don't really talk about, and it's really, really important, not just to women's health and relationships, but also fertility. I've seen many women who have had painful sex, but they want to get pregnant. And so this is a whole other area that we need to deal with so that you can have a successful pregnancy and you can continue trying as often as you need to. Now, if you're watching, that means you probably are experiencing some kind of pain, but I want to tell you that it doesn't have to be that way. For so many women in my practice, I've been able to teach them how to understand their pain and how to make changes in their life or in their bodies so that they don't have to experience pain and their intercourse, their sexual experience can be pleasurable. So I'm going to walk you through what to look for and how to understand what your pain is actually indicating might be going on in your body. Now, pain is a difficult thing because you have to explain it. It's not really something that can be examined by your doctor. It's more subjective. So you have to be really good at explaining what you're experiencing, when you experience, and what it feels like so that the health provider can actually understand what is going on. Now, for some women, you're able to be aroused, but you can't have any penetration. And for other women, any kind of penetration is painful. And that, of course, impacts your ability to get aroused, especially if there is fear associated with that or fear of pain. So we need to understand exactly what's going on and exactly what it's tied to. If you have pain during your period or just before your period, that tells you different things than if you have pain all the time, no matter what. It also matters if the pain is experienced, let's say, with insertion of a tampon versus intercourse. So if you are experiencing pain even with a tampon, that might tell you something different than if you are having pain only on intercourse or only in certain positions. I also want to digress here just for a second to talk about the fact that many women are embarrassed to talk about it or they're scared to ask for help. You need to ask for help. This is really, really important. There is no shame talking about your menstrual cycle, about your period, about painful sex. It impacts you in every part of your life, in your relationship, in your fertility. So if you are having struggles or challenges, ask for help from someone who will not judge you, who will understand where you're coming from, and who will be able to help you or at least point you in the right direction. Okay, so what causes painful sex? Actually, painful sex can be caused by many different things. Some things you might know and some things might surprise you. So the first thing is it can be physical. Of course, there might be some physical tension, some tightness or spasm of the vaginal area. There could be some endometriosis or scar tissue or something like that that might be physically impairing penetration or entry. And so that can impact the ability to feel pleasure or it could cause pain. There's also pain that can come from the GI, so the digestive system. Your intestines are inside, and if you're having cramps or stomach cramps, then you might feel pain that is transferred over what might feel like it's coming from the intercourse, but it's actually digestive pain. Or if you have some kind of generalized inflammation in your digestive system, let's say you have Crohn's or colitis or IBS, if you have a lot of inflammation and cramping and digestive problems, that can also be interfering with your ability to have pain-free sex. Sometimes it's related to your reproductive system. So if you have an ovarian cyst or if you have endometriosis or there's something wrong with your uterine lining, let's say you have a fibroid or something like that, that can also impact intercourse. Typically, depending on the position, it might change with your cycle. Certain times you might feel pain, whereas other times you might not. So these are usually indicators that it might be related to your hormones, hormonal cycle, or your reproductive organs. Another cause that people don't realize is it could be related to your bladder. So if you have frequent urinary tract infections, if you have cystitis, or anything that causes inflammation of the bladder or infections of the urinary tract infections, like that kind of thing. So that can also be impacting your sensation during intercourse. So that can also cause pain with sex. Sometimes it's related to the skin. So if you've had a yeast infection or bacterial vaginosis, that can also cause pain with intercourse because of the skin around the vaginal area, the labia. It's maybe raw or dry. That also happens when we age. So if you have any menopausal transition type symptoms, if you have dryness around the vaginal area, and if it's become raw and really tender, then that can of course cause problems with intercourse because there's so much pain on entry because of the skin dryness. Sometimes it's musculoskeletal. So if you have hip injuries or hip pain, or you have some kind of muscle cramping or muscle tension, that can impact it as well. And I notice this a lot in women who have very painful cramps. They also have a lot of physical problems. Let's say they have tight muscles at the pelvic floor, or they have hip pain. So that's another really big cause of painful sex. So we want to look at the muscles and the bones in the pelvic area. That can really make a difference when you're having sex. Now, of course, the other thing is emotion. So your emotion can really play a role. If you've had pain one time, then even the next time after that, you might be afraid, your body might be tensing up. I've actually noticed this in a lot of women who have had trauma, who have had some kind of traumatic experience or negative sexual experience. Maybe they were traumatized as a child. Maybe they had infertility pieces where they had some sort of miscarriage, and the emotions are really overwhelming, and that can cause pain going forward with any kind of intimate experience. I've also noticed it for women who come from certain cultural backgrounds where they're not free to talk about sex, or they don't think that pleasure is okay. They feel like sex is dirty. This is actually fairly common because a lot of women don't really talk about this topic while they're going through their reproductive years. And then once they are with a partner, they are unable to sort of relax during intercourse because that intimate feeling, they're unable to kind of relax and let their body go. And that can cause a lot of fear. And then of course it's a cycle, because one time you have fear, then it might be painful. And then that creates a cycle of more fear and more pain. So how do you know what is happening and why you're experiencing pain? The first thing is to understand when you feel the pain. So of course, paying attention to when, according to the timeline or the calendar, is it related to your cycle? Is it related to your ovulation or your menstrual period? These are important indicators to tell you that it might be hormonally related. But also you want to know when during the intimate experience you're feeling pain. So is it on entry? Is it on penetration? Is it on depth of penetration? So certain positions might cause pain, but other positions don't. If it's on entry, then it might give you a sense of the fact that it's more at the opening, the vaginal opening. Maybe you are not aroused enough and the lubrication is very low. Sometimes it's on penetration, so it could be something in the vaginal area. A lot of people ask me if size matters, and certainly there are some cases where there might be more friction and things like that, more so with the width as opposed to the length. But I do find that it's more related to your relaxation. So of course there is some piece of size that matters in terms of how you feel and your body. But if you're relaxed, typically the vaginal opening can expand quite a lot. If you think about you have to deliver a baby, the vaginal area can expand quite a lot. It's just a matter of whether you're relaxed, whether you have that lubrication as well. And then of course the emotions, the position, the depth, the speed of penetration, that all makes a difference. You also want to pay attention to if it is superficial pain or is it deep pain. So is it coming from the beginning part of intercourse, or is it coming later on once there is a depth? So if it's more superficial and it happens at the beginning, you want to look at vaginal infections, you want to look at dryness, you want to look at skin issues, you might want to look at fear or relationship issues. If you trust your partner, I've noticed also a lot of my patients will have trust issues where their partner maybe has cheated on them in the past and they're trying to kind of work through those emotions. That's of course going to impact your relationship and your ability to be intimate. Sometimes if it's a fertility journey, of course, you're having to have sex often, all the time. You might not be totally aroused when you're having the intercourse because you're thinking, okay, I'm ovulating, it's time, let's go. And so you might not actually be into it as much, and that can play a role as well. So in those cases, using some kind of fertility-friendly lubrication can really be helpful. I also wrote an article on mindfulness during sex that can really help you to hone in your brain and sort of your experience and being in the moment and really staying in the moment. That can also help to assuage any like distractions, but also if you're having any fears and things like that, it really just helps you to stay in the moment. And that can kind of help, especially if you're thinking about, is this going to make a baby? What's going to happen after? So it really just helps you stay in the moment, and that can help relax you as well as improve your ability to release your own lubrication, your natural lubrication that makes you wet. Sometimes you will have what's called vaginismus, where your muscles in the vaginal area almost like spasm, or they get really tight. So this is something that you might want to be examining with a pelvic floor physiotherapist, someone who can actually examine the muscles in the area of the pelvic region and the vaginal region, because they can give you a sense on if your muscles are really tight or if there's anything going on in that area. Because if that's the case, then you might need to use different techniques. So of course, if it's emotional, we use emotional techniques, relaxation, we talk about libido and relationship. But if it's a physical technique, you might need to talk to someone like a pelvic floor physiotherapist who can actually examine your muscles in the pelvic floor and say whether or not you have some tightness going on, if there's any muscle spasming happening. And then there are techniques using physical things like dilators, for example, where you're inserting different sized dilators over time. As you get used to each size, you kind of move up to the next size. So that's one technique that they might use. They might give you other types of stretches or exercises, but it usually can be addressed from a musculoskeletal perspective versus an emotional perspective. If it's more of a deep pain, you want to look at other potential causes. So some women have something called adenomyosis, where it's inflammation at the uterine area. This often happens if you've had a lot of inflammation, very painful periods, that kind of thing. You might want to look into that potential diagnosis. Some people have it if they have bladder or urine problems, as I mentioned earlier, cystitis. A lot of women with endometriosis will have very painful sex as well. And so endometriosis causes many different types of symptoms, one of them being very painful period. There's also a lot of inflammation that's associated with that condition, which can also contribute to intercourse pain. Another one is when you have digestive problems. So if you have hemorrhoids or any kind of bowel issues or polyps or IBS, irritable bowel syndrome, or you have any type of digestive diagnosis, that can also contribute to deeper pain when you're having sex. And then of course, if you have any kind of hormonal problems, so uterine fibroids, ovarian cysts, that kind of thing, that can also impact painful sex and also create pain during sex, but in particular typically happens a little bit more deep. So not necessarily on superficial entry, but when you're deep or when you're in a certain position or when you're at a certain time of your cycle. Sometimes women will have pain as a result of some kind of past surgery or some kind of trauma in their past. So let's say they've had some sort of surgery for endometriosis or chemotherapy, or they've had some sort of radiation. Maybe they've had scar tissue, that kind of thing. So if they've had a traumatic experience or some kind of intervention, then that can also cause pain during intercourse. So some women will come in and say to me, I was totally fine, and then I had my kids, and then I had some issues, or I went in to get something examined or a fibroid removed, and now I have painful sex. That can happen if you have scar tissue buildup. And so in those cases, there are certain other types of treatments that you need to do. So sometimes it's managing scar tissue. Sometimes it is managing circulation. Sometimes it's relaxing muscles. So that can make a difference. And then of course, there's always the mental emotional piece, because we have to look at relaxation and those kinds of things as well, because it all relates together. So what can you do about it if you are having painful intercourse? The first thing is to identify where it's coming from. Is it on superficial entry? Is it deep? Is it physical? Is it emotional? So identify where it's actually coming from so that you know what steps to take to deal with it. You also want to look at your overall health history. So you want to know all the different systems that could impact you and what kinds of symptoms you might be getting. So do you digest well? Do you get bloating, gas, indigestion? Could there be something in your digestive system that you are not aware of? Do you have chronic inflammation? Do you have problems with your period? Do you have dryness? Do you have frequent vaginal infections? So you want to really look at a full health history and not just looking at your intercourse or relationship history. So that will usually include a health history. You want to get a physical exam, so either by your gynecologist or a pelvic floor physiotherapist, someone who can actually examine you physically so you know if there's something going on in the vaginal area or in the lower abdomen area. You also want to look at emotional support. So talking to a health provider who has qualifications in helping you to work through the emotional piece, like a counselor or something like that. It's really important to be able to talk through the process, your progress, your experiences, your fears. These are all really important, and it can be important no matter what the cause is, because of course, anytime you have painful sex, it's going to be emotionally stressful. In terms of treatment protocols, sometimes it's going to be about changing what's going on with you and your partner. So it might be a change in position, it might be a change in foreplay, it might be a change in how you interact before having intercourse. It might be a change in technique, or looking at your libido and trying to figure out how to improve your natural lubrication, or using external lubrication. So sometimes it's about that. Sometimes it's about stress management, because sometimes the stress can play a role. So we're looking at treatment techniques that are going to fit for your situation. Sometimes it's pelvic floor physiotherapy, which I mentioned. Sometimes it's general fitness. So if you have back pain, then that's of course going to impact your ability to change positions. So we want to look at treating your back pain or your physical pain. We also really want to look at your arousal. So this is where sex drive, libido, and your ability to get aroused really play a role. So I'll do a whole other video on libido, but we want to look at how we can improve your desire and your arousal during intercourse or during foreplay, so that your body is more relaxed, so that you're more into it, you have more lubrication, you're more wet. All of these things make a big difference in your experience. I also really believe that you need to have a good healthcare team. You need to have someone who's looking at some of the physical aspects, like a pelvic floor physiotherapist. You might need a medical doctor or an OB-GYN to look at some of the reproductive aspects. You also need a counselor to look at your mental emotional side. And then you also need someone who's going to help you with your overall health, your libido. So someone like myself, a naturopathic doctor, someone who can actually look at your overall health and your state of health. So your nutrients, your digestion, all of that, it plays a role. So you want to make sure you have a good team around you so that you can deal with this fully and completely. The other thing that's really important is talking to your partner. So many women will say, I have this painful sex, and then they tell their partner that they're not experiencing something good, they're having pain, but then they don't really get into any more detail than that. In my experience, most male partners are willing to talk about it. So especially in my practice, I deal with a lot of fertility cases or a lot of women's health issues. And so a lot of times when they're having their painful sex, they just stop having sex, or they just withdraw a little bit. But often when I talk to the male partner, they're usually really interested in helping the woman get over her pain. Or if you're in a same-sex relationship, the other partner will of course want to help you, because of course it serves them, it's good for their sex life, good for their relationship. But more often than not, I find that they're really concerned about your well-being. And so they really want to make sure that they're supporting you in this journey, because they understand how painful, how stressful, and how private this issue can be. So I really encourage couples to talk about it, either on their own or in the presence of a third party, maybe a health provider, because once we get into it, we usually find ways of talking about it that can actually help the couple open up the conversation and learn about each other and how we can actually move forward. Now, I know this conversation can be very difficult. Sometimes it's embarrassing, or you don't want to talk about it, or it's too much detail. But I really feel like if you talk about these things, because they are so important in a relationship, it will strengthen your relationship, especially if you come from a place that is non-judgmental, if you feel safe and you're able to open up what your fears are. And then if you are able to make progress, or at least take steps to try to resolve the issue. I find that both partners being supportive, being open, being willing to try new things and experiment, all of this really makes a difference and is critical on the journey to success. I would love to know from you in the comments, are you able to talk to your partner about these types of sensitive issues? Painful sex, just intercourse in general? Is it something that you can open up and really talk about in detail? And if not, why not? If you're still confused on what's going on in your body and you're not sure what you actually are experiencing, I have a free download. It's a checklist that can go through everything that I've talked about so that you can actually figure out where your pain is coming from, and then it'll help you to figure out the next steps on how to resolve that pain. So just click in the link and you'll get the download. Thank you so much. If you liked my video, please remember to give me a thumbs up, share it with your women friends in case anyone's going through this and they might not want to talk about it. Make sure you let them know that there is information out there, and remember to subscribe to my channel and hit the bell for notifications of new videos. Thanks so much. See you in the next video.